Hi, my name is ESkehan, and my poster presentation explores hepatitis C trends in incidence and prevalence and populations at risk. As recently as 1989, scientists did not know what to call a hepatitis virus that was known as non-A, non-B. It is now known as hepatitis C virus. Findings from a review of the literature regarding this public health issue will be discussed. Conservative estimates of the prevalence are that over 1% of the population in the U.S. is living with hepatitis C disease. More than half, 51%, of those living with HCV are unaware. As recently as 2009, the cohort with the highest rates were the baby boomers. This paradigm has shifted, and multiple generations are experiencing high rates of infection. Data from 2018 revealed that millennials account for the lion's share at 36.5%, baby boomers account for 36.3%, and Generation Xers account for 23.1% of new cases. HCV puts them at risk for severe liver disease and transmitting the virus to others unknowingly. Unlike hepatitis A and B, there is no vaccine available. Early recognition, early diagnosis, early treatment, and prevention are the keys to improving outcomes, preventing further spread, and providing patient-specific education to eradicate this disease. Nursing will be instrumental in providing HCV screening, counseling, education, and interventions. The pie chart to the far left illustrates a visual of the social generations, or otherwise known as birth cohort. The millennials are in green, the baby boomers are blue, and the Generation X are yellow. The table on the left depicts the distribution of newly reported cases by sex, age group in years, and social generation or birth cohort. Males comprise 63.1% compared to 36.9% females. The 30 to 39-year-old group accounts for 23.4% of the new cases. The millennials, born in 1981 to 1996, accounted for 36.5% incidence of new cases in 2018. The graph below Table 1 depicts the distribution related to birth cohort and the three most affected. The last chart in the column depicts the distribution of males in light blue and females in dark blue. Examples of primary prevention, secondary prevention, and tertiary prevention are provided. Below that is a map with rates of reported acute hepatitis C by state in 2018. Screening should occur, especially for those most at high risk, and those include people with HIV, current or former drug users. The most common traits of those most at risk for cirrhosis include males over 50 who consume alcohol. And treatment includes antivirals specific to HCV genotypes and are highly efficacious. In summary, HCV is insidious and often unnoticed until liver damage has already occurred. 10 to 20% of those infected with HCV will develop cirrhosis within 30 years, and 1 to 5% of those will be at increased risk for liver cancer. There is no vaccine. Nurses are in a unique position to screen patients, to aid in diagnosis and treatment, and provide primary prevention through education and raising awareness. Thank you for perusing my poster, and these are my references. Have a great day.